Now that you understand how tissue trauma can silently sabotage your healing from the inside out, let's talk about what I actually do with my patients in my clinic to support their recovery. First, I recommend high-dose vitamin C. We're talking 2,000 to 4,000 milligrams daily, split into divided doses. Vitamin C is absolutely critical for collagen synthesis and tissue repair. Your body burns through it rapidly when dealing with inflammation and trauma. Next is zinc. I typically prescribe 30 to 50 milligrams daily with food. Zinc is essential for wound healing and cellular regeneration. Most of my trauma patients are severely depleted. I also use omega-3 fatty acids, specifically EPA and DHA, at therapeutic doses of 2,000 to 3,000 milligrams daily. These powerful anti-inflammatory compounds help modulate the inflammatory response and support cellular membrane integrity. Finally, I prescribe a high-quality B-complex vitamin because the B vitamins are crucial for nervous system repair and energy production at the cellular level. These aren't random supplements. This is a targeted protocol I've refined over 20 years of clinical practice. But how do you know if you actually have tissue trauma? In my next video, I'll tell you exactly what lab tests to ask for.